Hello, everybody. It is Nurse Eunice with Florida Training Academy. Good evening. This is Wednesday, April the 3rd, and we are going to complete the second half of handling medical emergencies. So we'll give our viewers a few more minutes to join. If this is your first time joining, go ahead and let us know your name, where you're from, whether it's the States or another country. We love having you as our viewer. And again, we'll get started in a few more moments. This is Nurse Eunice with Florida Training Academy, helping my CNAs, my CNA buddies, pass their examinations. All right, so let us begin. Question number 26. So this is part 2 from the video that I shot on, I think, Sunday. So question 26, what should a nursing assistant do if a patient is experiencing a panic attack? A, encourage deep breathing exercises. B, administer a sedative medication. C, restrict movement to prevent injury. Or D, offer a caffeinated beverage. Yes, Daves, you are correct. Great job. Yes, Beatrice, great job. Everybody, it is A. We're going to encourage deep breathing exercises. Remember, deep breathing exercises can help alleviate symptoms of panic attacks by promoting relaxation and reducing hyperventilation. All right, let's go to our next one. 27. Which of the following is a sign of internal bleeding? A, paler or turning pale. B, warm, flushed skin. C, abdominal distension. Or D, decreased heart rate. Yes, I see a lot of correct answers for 26. Let's see what you have for 27. Revealing the answer in 3, 2, and 1. Yes, Carla, it is C. Great job. So it is going to be abdominal distension. And here's our rationale. Abdominal distension can indicate internal bleeding. As blood accumulates within the abdominal cavity, it can cause swelling. And of course, your patient will be complaining of pain. And this could be common after maybe a car accident or some type of slip and fall injury. 28. You are a certified CPR and first aid provider. What is the appropriate response if a patient is experiencing an overdose? So for this one, I want you to think that you're in home care. It's you and the patient. Patient may have been prescribed opioids and you find them and they're unresponsive. Do you A, administer a stimulant medication, B, encourage the patient to drink fluids, C, administer naloxone or Narcan for opioid overdose, or D, apply ice packs to the forehead? Carla, looks like you're ready for your test, dear. Yes, Liz, great job. Yes, so if you're in a hospital, of course, your nurse would be administering Narcan. But if you're in home care and you're taking CPR and first aid, Narcan is part of your training now. So you can administer Narcan intranasally. Narcan is an opioid antagonist. In other words, it binds or reverses the effect of the opioids to help restore normal breathing. And if you're in Jacksonville, we do provide Narcan to all of our CPR students. So if you come in for CPR BLS, you actually leave with Narcan training and your free Narcan devices. Question 29. What action would you expect the nurse to take if a patient's oxygen saturation level falls below normal? A, administer supplemental oxygen. B, encourage the patient to cough forcefully. C, check the blood glucose levels. Or D, elevate the patient's legs. Your patient's oxygen level has fallen. You have a brand new nurse. What do you expect her to do? Thank you for the heart, Almas. Hi. Revealing the answer in 3, 2, and 1. You expect that nurse to administer supplemental oxygen. So the reason why I chose this photo is the patient has a nasal cannula. So that would be a way that a patient can receive their oxygen to increase their blood oxygen levels. But you all, what's wrong with her position? So administering oxygen helps to improve the oxygen saturation levels and helps to alleviate hypoxemia, hypo, low, Zemia, the level of oxygen within the blood, so hypoxemia. But this person's position is wrong. So while you're waiting for the nurse to come to administer the oxygen, I need for you to be sitting this patient upright. 30, what is the recommended action for managing a minor burn injury? Is it A, apply ice directly to the burn? B, cover the burn with a dry, sterile dressing? C, rub butter or oil on the burn? D, pierce any blisters that form? Yes, Carla, her head is wrong. She needed to sit up more. All right, so now you have a patient who has burned herself. You're in home care. She burned herself. While you're waiting for the ambulance to get there, what do? Yes, Florraine, you are correct. The answer is B. Daves do not cook anyone's skin by adding butter. That is a misconception. So in this image, looks like she has a water bottle. Here in the States, we have running water. If you're somewhere where you don't have running water, you can always take a water bottle. So first you want to cool the burn with cool water. That wasn't an option given. The option given was B, cover the burn with a dry, sterile dressing, but try to cool it first. And then, of course, if you're in home care, you're going to be notifying 911, and then you'll also notify the nurse. If you're in the hospital, hopefully this person will not burn themselves, or in a nursing home, unless they're smoking in their room or doing something they're not supposed to be doing. Question 31, which of the following is a symptom of anaphylaxis? So anaphylaxis is a severe allergic reaction. Is it A, bradycardia or slow heart rate? Is it B, hypotension or a low blood pressure? C, swelling of the face and throat? D, shallow and slow breathing? Looks like I have one correct answer so far. Revealing the answer in 3, 2, and 1. 2 correct answers. The correct answer is C. So swelling of the face and throat could be a sign that your patient is experiencing anaphylaxis. And that's a hallmark symptom. So make sure, of course, that's a medical emergency. You're going to be monitoring your patient. If they have an EpiPen prescribed and you're in home care, you can assist them to use it, but you're always going to call for assistance when there's an emergency. All right, number 32. You work in a group home. So this is usually like independent patients. It could be like transitional housing, but they usually will have a CNA and a nurse who comes in and out. So you work in a group home and your client is allowed to administer her own medications. What is the appropriate response if a client with a history of asthma is experiencing an asthma attack? Do you A, administer a sedative medication? B, encourage the patient to lie flat on her back? C, instruct a resident to use her bronchodilator inhaler, aka albuterol? Or D, apply heat packs to her chest? Great job. I can't trick you at all. Notice I didn't say that you gave it. Once you pass your CNA examination, there are different classes that you can take that will, where you can actually assist people, remind them to take their medications. So that's what you do in this instance. The answer is C. Instruct the client to use her bronchodilator inhaler. And so in the image there, you're just talking her through it. And of course, you're going to notify the nurse. Make sure you keep monitoring the patient, because if this doesn't work, she may have an order for a second dose, but we may have to send her out to a hospital. Question number 33. You are working in home care. What should you do if a patient experiences sudden chest pain that radiates to the left arm and jaw? Do you A, apply a cold compress to the chest? B, administer Tylenol? C, encourage the patient to rest? Or D, activate emergency medical services? Blossom, good luck on your test that's scheduled for next week. Yes, caller. Yes, Denzan. Yes, Jerlyn. Yes, Dana. Great job. You all are going to activate emergency services. So that's going to be calling 911 if you're in a home care setting. If you're in an assisted living facility and maybe there's a nurse on duty, you'll also be activating that nurse. So sudden chest pain with radiation to the left arm and jaw can be indicative of a heart attack requiring emergency treatment. 34. Which of the following is a sign of a worsening head injury? All right, so bradynypia, excuse me, that's when the breathing is shallow and slower than normal. B, widening pulse pressure. C, constricted pupils. Or D, decreased level of consciousness. Yeah, Carla, I thought it was C too, but that's not the answer this time. What is something that the CNA can like readily see without using a pen light? Because you all do not walk around with pen lights. It is going to be yes, Melanie, and someone else had the correct answer also. It is going to be D, decreased level of consciousness. Decreased level of consciousness is a common sign of increased intracranial pressure, reflecting neurological impairment. So if your patient starts to be less responsive, that is a sign that their condition is worsening. 35. What is the primary goal of wound care? A, minimize pain. B, prevent infection. C, promote healing. D, reduce scarring. Why are we having the nurses go in and change the dressing, clean the wound? This could be one of two answers. And the two answers would be what Melanie and Florraine chose. And so for this one, the correct answer is, in order to promote healing, we have to do B. We have to prevent the infection. So the primary goal of wound care is to prevent infection, as infections can delay healing and lead to complications. So when we ask you to offload to raise those patients, feet up so the heels are not touching the bed or the pillow. We ask that you put pillows between their knees so the inside of the knees or the inner toes are not touching. We're doing that intentionally because we want to prevent that pressure sore. We prevent pressure sores. We also decrease moisture. We'll be more likely to prevent sores from forming and also prevent any wounds from developing. So great job, team. 36. What action should be taken if a patient is experiencing a seizure with tonic-clonic movements? They're thrashing. Are we going to A, restrain the patient's movements? B, place a padded tongue depressor in the mouth? C, move nearby objects away to prevent injury? Or D, administer an oral medication? And none of you ever should choose D. Yes, Tenzine. Yes, Dana. Yes, Elise. Great job, team. The answer is C. We're going to move nearby objects away to prevent injury. Ensuring the patient's safety by removing nearby objects helps to prevent injury during the seizure with tonic-clonic movements. And so this person's on concrete. That bag that she has like wrapped around her, that strap, we need to try to get that off of her. So we can cut that and we can put something beneath her head so that her head doesn't actually hit the concrete. You can use a purse. You can use the bag that she has there. If it's soft enough, you can use a jacket. If you're in a hospital, we're going to ask that you pad the side rails of the bed so that if a patient does experience a seizure, they won't hit the rail and injure themselves. All right, so question 37. Which of the following is a symptom of heat exhaustion? A, bradycardia or slow heart rate. B, flushed skin. C, hot, dry skin. D, decreased urine output. This person's still able to talk. They're outside in the heat. What do you expect? A low heart rate? Flushed red skin? D, hot, dry skin? C, hot, dry skin, or D, decreased urine output. I know it's a tie between C's and B's, and now we have an A. So for heat exhaustion, everybody, we got to get this gentleman inside the house, or maybe the house is really hot. He probably needs to take off that long sleeve shirt. So the correct answer is going to be B. They're going to have reddened or flushed skin. Flushed skin is a symptom of heat exhaustion. indicating increased blood flow to the skin as the body attempts to cool down. You can give this person room temperature water, you can fan them, take off any unnecessary clothing, and of course, get them into the shade and out of the heat. 38. What is the appropriate response if a patient exhibits signs of a stroke, such as sudden weakness or numbness on one side of the body? Is it A, administer pain medication, B, encourage the patient to walk around, C, keep the patient awake until the symptoms resolve, D, activate emergency medical services? This was an easy one for you all. Yes, yes, yes. You all have the correct answers, and the correct answer is all right, D, we're going to activate medical services. So sudden weakness or numbness on one side of the body can be indicative of a stroke requiring immediate medical attention. And in one of the other videos, I talked about the FAST acronym. And so F, you're going to look at their face. A, you're going to ask that they raise their arms. And if one arm droops down or doesn't raise as high as the other arm, that could be the sign of a stroke. And S, you're going to ask them to speak, to say their name, and it's probably going to come out garbled or slurred. T is time to call 911, or if you're in the hospital, it's time to call a code. And that would be the FAST assessment when you think your patient or client is experiencing stroke-like symptoms. 39. Which of the following is a sign of an airway obstruction? A, clear breath sounds. B, loud snoring during sleep. C, stridor. Or D, slow, regular breathing. This one may be hard because there's a new term that you've not heard before. I know what you're thinking, Carla and Dana. You're thinking about obstructive sleep apnea, but for this one, they're talking about like a foreign body airway obstruction, like the person may have choked. So the correct answer for this one would not be B. If you chose C, you are correct. It is stridor. So stridor is a high-pitched sound heard during inspiration, and it's a common sign of an airway obstruction. And so if the child or the adult has been taught the universal choking sign, usually they would clutch their throat, but they're unable to speak. They're unable to cough. You may hear a high-pitched sound, and that would indicate that you would have to assist them by doing the abdominal thrust, previously referred to as the Heimlich maneuver. Question 40. What should a nursing assistant do if a patient experiences a sudden loss of consciousness and is not breathing? A, begin chest compressions. B, place the patient in a supine position. When you hear the word supine, take the U out, and the person is laying on their spine. They're laying flat. C, administer oxygen via nasal cannula, or D, offer a glass of water to drink. Your patient's not breathing, you all. So yes, 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 I need for you to call a code. You're going to begin your high quality chest compressions. And so even though here it didn't say to call the code, above the beds would be a panic or a code button. If you're in the hospital, that would, or nursing home, that would be how you get help right away. But if you don't alert the team, if you just start doing your chest compressions, you're going to be exhausted. But if a patient is not breathing and they have no pulse, you're going to start those chest compressions to circulate the oxygenated blood. But don't forget to call your team because you need someone to come in and to assist you. 41. What is the primary goal when managing a patient with a suspected spinal injury? A, immobilize the spine. B, encourage the patient to move around. C, apply heat packs to the affected area. Or D, perform range of motion exercises. Yes, Dana. Great job. Great job, Carla. And so in this image, we have a patient who has fallen to the ground. I know it's going to be tempting for you as a CNA to say, hey, let me help you up. Absolutely not. you will not help them up. You're going to have them stay on the floor until the nursing team arrives, or if you're in home care, until the rescue comes, 911. So I need you to keep them as still as possible because immobilizing the spine can help prevent further damage and reduce the risk of spinal cord injury in patients suspected of having spinal injuries. So keep them calm, but keep them on the floor. 42, which of the following is a sign of compartment or compartmental syndrome? Is it A, pale, cool skin, B, decreased pain with movement, C, paresthesia or tingling or numbness, or D, increased range of motion? And so as far as compartmental syndrome is concerned, think about somebody who has a fresh cast on. Whenever someone has a fresh cast, there could still be some swelling there. And because there's not enough circulation, how do you think that patient's going to feel? Yes, everybody, great job. It is C. Paresthesia is a common symptom of compartment syndrome indicating nerve compression due to increased pressure within the muscle compartment. So after someone has a cast on, or maybe they have a dressing or something, we're going to ask that, that we do pulse checks, that we check for coloration. We ask the patient to wiggle their toes, wiggle their fingers, because we want to make sure that we're not compressing on any nerves or causing any decreased blood flow. 43. What action should a nursing assistant take if a patient experiences a sudden, severe headache with nausea and vomiting? How scary. A, are you going to administer antihistamines? B, encourage the patient to lie flat on their back? C, provide pain medications? Or D, activate emergency medical services? Let's see, sudden and severe headache, and they're vomiting. That sounds like above my pay grade. I'm going to be calling the nurse. So if you're in the hospital, you're pressing that code button. In home care, you're calling 911. So the answer is D, because a sudden and severe headache with nausea and vomiting can be indicative of serious conditions such as stroke, intracranial hemorrhage, necessitating immediate medical attention. And so if you haven't subscribed, my name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy. I'd love to be your mentor, whether it's for CNA classes, CPR, or nursing classes. If you hit me with the super chat, it'll give us a little bit of money for coffee, because lately I've been getting on here late in the evenings after work, just trying to get the videos done to help you all pass your test. And you can also go to nurseeunice.com and you can leave a tip there so I can buy me some coffee. So Nurse Eunice loves coffee. All right, let's move on. Question 44. What is an appropriate response if a patient is experiencing a severe allergic reaction with swelling of the lips and tongue? For this one, I want you to think that you're in home care and you are a certified CPR and first aid provider. Do you give them a glass of water? Do you administer corticosteroids? Do you apply a cold compress? Or do you use the EpiPen? Yes, everybody use the EpiPen. They have it prescribed for a reason. In this case, if you don't have a nurse like right there, do not delay, because this patient's airway could close. You want to help them use that EpiPen because more than likely they've eaten something that they're allergic to. And some of the common allergens are, of course, like peanuts, shellfish. Maybe they didn't know that food had eggs in it. So they already have this medication prescribed to them, and you can assist them with administering it. So a severe allergic reaction with swelling of the lips and tongue can lead to airway obstruction, and epinephrine or the EpiPen is the first line treatment to reverse this effect. So if you're in the hospital, your nurse has intravenous IV epi, but if you're in home care, you can't wait for the nurse to get there. I need you to use that resident's EpiPen or help them use it. Question 45. Which of the following is a symptom of carbon monoxide poisoning? A, flushed skin, B, bradypnea, C, headache, or D, hypertension? Carbon monoxide poisoning. You're being poisoned by an invisible gas. Yes, Carla. Blossom, I see you. I think I made one already, so I have to go back and find it, the video on the role of the CNA. So for everybody, Initially, the person's going to experience C. They're going to experience a headache. So headache is a common symptom of carbon monoxide poisoning, often described as dull and continuous. And remember, carbon monoxide is odorless, it's tasteless, so they don't even know to leave. They don't know that something inside the house is poisoning them. So in some areas, whenever you purchase a home, they're going to recommend that you go ahead and have a carbon monoxide detector, so that, if you're living in certain areas, you won't become a victim of carbon monoxide poisoning. Question 46, what action should be taken if a patient experiences, oh, this is easy, a foreign body airway obstruction and is unable to breathe, speak, or cough? A, perform abdominal thrust, aka Heimlich maneuver. B, encourage the patient to lie flat on their back. C, offer a glass of water. D, administer oxygen. And E, just for giggles and laughs, hit them in the back. The answer is never E. If someone is coughing or if they're choking, when you hit them in the back, you don't dislodge the object, you push it further down. So looks like everybody got 46 correct. And 46 is A. You're going to perform those abdominal thrusts, previously referred to as the Heimlich maneuver. So the abdominal thrust helps to dislodge foreign bodies obstructing the airway and are indicated when the person cannot breathe, speak, or cough. If they are able to cough, you encourage them to cough, and don't let them just go in the bathroom by themselves and close the door, because a mild obstruction could become a complete obstruction, and we don't want them, worsening while they're in the bathroom with the door locked. So just follow your resident, if they're trying to walk away because they don't want to be coughing at the dinner table, encourage them to cough. But when they're unable to breathe, speak, or cough, that's when you're going to step into action and do the abdominal thrust. Question 47. What is the appropriate response if a patient is experiencing a hypertensive crisis with severe headache and nosebleed? Is it A, encourage the patient to rest quietly? B, apply a cold compress? C, administer an anticoagulant medication? Or D, activate emergency medical services? Hypertensive crisis, headache, nosebleed. Yes, everybody, this person needs more than what you can do as a CNA. As a CNA right now, you're going to provide comfort. You're going to, take their blood pressure again, hold their hand, and stay on the phone with the medical team, because you're going to do D. You're going to activate the emergency medical services. Hypertension or hypertensive crisis with severe symptoms requires immediate medical attention to prevent complications. And in the image, I have some of the reasons that a person's blood pressure could be extremely high. So a hypertensive crisis, I want you to think of the systolic blood pressure greater than 200. Diastolic blood pressure greater than 100. So if your patient's blood pressure is greater than 200 over 100 and they're having symptoms, they have to go. And that could be caused by alcohol, obesity, heart disease, kidney disease, pregnancy, preeclampsia. So some of your pregnant patients, they will have severe or high hypertension, blood pressure, and of course, consuming too much salt, and also smoking and diabetes. So, multiple reasons that a person's blood pressure could be extremely high. 48. Which of the following is a sign of an opioid overdose? A, bradycardia, and this again is something that the CNA could see. B, hypertension. C, pinpoint pupils. Or D, hyperactivity. Someone has taken a substance that has fentanyl in it. Yes, this time it is C. It is the pinpoint pupils. And for those of you who do not know what pinpoint pupils look like, I have an image here. So pinpoint pupils are a classic sign of an opioid overdose due to the central nervous system depression caused by opioids. So the image on the left shows the normal constricted pupil, but the one on the right, when the person's eyes are closed, when you open the eyes, you're going to see a really small pupil. That usually means that a person has overdosed on something. And so again, medical emergency, if you're in home care, drug rehab center, usually we're going to be administering Narcan, and you monitor the patient. All right, we're almost done, everybody. 49. What is the primary goal when managing a patient with an open fracture? A, reduce swelling. B, prevent hospitalization. C, minimize pain. Or D, prevent infection. An open fracture, that just means that the bone has broken through the skin. So not only did it break, you have bone sticking out the skin. And for this one, we can't minimize pain. They need surgery. So yes, Patricia, yes, Alicia, yes, Genevieve. It is D as in dog. We want to prevent infection. So preventing infection is crucial in managing open fractures to minimize the risk of complications such as osteomyelitis. So if you can, just very softly or gently, you can try to put a gauze or something on top of it if it's bleeding, but we want to try to prevent infection. And in this image, this shows a closed fracture where you can see the bone is broke, but in an open fracture, the part of the bone that is broken actually penetrates through the skin. And so there's nothing you can do about that as a CNA. They need surgery. You can comfort them, try to prevent blood loss, but that's usually, all you can do. If you try to wrap it too tightly, put a splint on, as soon as the paramedics get there, they have to take all that off. So keep them calm and put some gauze on it to control the bleeding and decrease the risk of infection. I'm going to miss you all. This is our last one. Question 50. What action should a nursing assistant take if a patient's tracheostomy tube becomes dislodged? For those who don't know what a tracheostomy is, it's their artificial airway. They have a tube coming out of their trachea. They have a tube coming out of their trachea. Is it A, notify the nurse? B, encourage the patient to cough forcefully? C, apply a cold compress to the neck? Or D, administer oxygen via nasal cannula? And you all are so smart. I see the correct answers there. And the answer is A, notify the nurse immediately, because that's the patient's breathing tube. This is how the patient's breathing. They're breathing through their neck. So for you to put nasal cannula or oxygen through their nose, that's not going to help them because they're not breathing through their nose. They're breathing through the opening in their neck. And so if that tube comes out, medical emergency, we need the nurse or the respiratory therapist to reinsert the tracheostomy tube and to maintain that patient's airway and oxygenation. So my team, my CNA buddies, you all did such a great job. So thank you for watching. We have additional videos. I'm also going to come on here tomorrow and do another video. If you want CNA freebies, we have practice questions. We also have cheat sheets. You go to nurseeunice.com. If you would like to take a CPR CNA instructor level class, we're located in Jacksonville, Florida, and you can do so by going to fltraining.com. You're great also, Carla. I appreciate all of you. Oh, I know it's too short. Patricia, tomorrow will be 70 questions. I promise. It'll be longer tomorrow. All right, everybody. I got to go shoot another video. So the next video I'll be shooting will be on condom catheters. So if you're interested in learning how to put a condom catheter on, I'll have that video. I'll film it tonight, but I'll actually show it tomorrow. So good night, everybody. And good luck on your test. See you tomorrow. Bye, Tenzin. Thank you, Alicia. Your ID number. Alicia, I'm going to put my email address in the chat. It's admin@fltraining.com. I don't understand the question, so make sure you send me an email, okay? That way I can try to assist you as much as possible. Bye, everybody.